from 1938 until the end of August in 2017, Wabash Valley always had an inpatient program. So what's that? That's just short of 80 years. We don't have an inpatient program anymore. Many people, they say, where do you work? I work at Wabash Valley. And they say, oh, I know Wabash Valley, it's that building down there. That's where people go for psychiatric inpatient. And that's what, so you're running the hospital. And I said, no, that might be 5%, 3% of our business. We have not told people who we are and what we do. I purposefully went out to the branches and got to know the staff, got to know the directors, and worked with them in a direct way, so when somebody from upper administration walks into the building, it isn't something horrible that's happening. It doesn't make a difference what job it is. Every one of those jobs is important. I was brought up in a small town in eastern Indiana. Where we lived was not in the small town. We lived 8 miles outside of town on a farm, went to a different school. And so the kids in the church really didn't want anything to do with me because I was, an outsider. So there was a young man who was from the town, and he and I befriended each other. His name was Denny. Graduated from high school. I went to college. He ended up working for the local grocery store. Then I lost touch with him. So I found a master's in social work, went to Ohio State, got my graduate degree. And my wife and I were married while I was in graduate school, decided whoever got a job first, that's where we go. So she got a job teaching school in Muncie, Indiana. I got a job at the local mental health center. So I was talking to my parents one day, just telling them, what's happening on the job, and I told them what I was doing. And so my mom says, when you go down to Richmond State Hospital, you need to stop and see Denny. And I said, Denny, Denny from, she said, oh yeah, stop it, go see him. He's a resident there. Found out what ward he was on and went to see him. And so he said, what have you been doing? So I talked to him about going to school and graduate school, getting married, the job and so forth. And I said, what about you? He said, after you're done with undergrad, I ended up having a major psychotic break and coming to the state hospital, and I've been here ever since. And I got a call one day that he was in the local hospital, not on the psychiatric unit, but he was on a medical unit. He had had a tumor that had grown on his spine. And the doctors had said he must have been in such excruciating pain. But he didn't tell anybody that until it got to the point where he tried to get up out of bed and he couldn't. He was paralyzed from here down and he fell on the floor. And I said, how come you didn't tell anybody? And he said, Tom, if I was worried that if I told somebody, they were going to send me back to the state hospital. And I did not ever want to go back to the state hospital, so I didn't tell anybody. I think it has been because of the stigma about mental health disorders, mental illness, that, oh gosh, I'm going to get services at Wabash Valley. I don't want people to know I'm going there. He ended up passing, unfortunately, but he passed. And so what I had decided at that point was that if I could work with people like him that have severe and persistent mental illness and help them trust people enough to where if they had some issues like that going on in their life, they would tell somebody. We have been a hidden gem all these years. When you go to our branch in Delphi, every person that's new that goes up there can't find it. People would say, there's no sign. You're right, there's no sign. The first thing that we need to do is just get out in front of the community and say, who are we? What services do we provide? Historically, what we've done is that, well, the addictions people, here, you go down this hallway, or you go upstairs, and the mental health people go down this hallway and stay downstairs. We're moving in the direction of integrating them and that we have to look at them as a whole, that they have substance abuse as well as mental health issues. We now are retooling all of our addiction service. There's so many more things about addictions than just opioids. And it's okay to get help with your addictions. It's okay to get mental health services. Thinking of people like Denny, who, not just myself, but how many people across our whole agency, the agency where I used to work, that we touched to try and help them with that type of situation. We have a mission field right here and in Indiana, and that's what I've dedicated my life to.